Shock is a secretory condition in which there is loss of effective circulating blood volume and inadequate organ and tissue perfusion, resulting in derangement of cellular functions. Or you can also define shock as: shock is the body's response to decreased circulating blood volume that results into impairment in tissue perfusion, which culminates eventually into cellular hypoxia. Classifications of shock. Shock can be classified into any of the following: hemorrhagic shock, also called hypovolemic shock. This is a type of shock that results from the loss of plasma or whole blood. The loss of blood may be external or internal. When more than 10% of the blood volume is lost, hypovolemia occurs, which is low body blood volume. And once there has been low body blood volume, it leads to a decrease in the blood pressure and eventually leading to shock. Number 2, neurogenic shock, also called psychic shock or vasovagal shock. This is a type of shock that results from extreme or excruciating pain or fear, and it occurs immediately as a result of fright. For example, receiving bad news or sudden severe pain to a sensitive part. This will lead to a marked vasodilatation and reflex inhibition that results in a sluggish circulatory system, depriving the vital organs of blood supply and eventually leading to shock. Number 3, bacteremic shock, also called septic or toxic shock. This is the type of shock that results by a change in the capillary endothelium, permitting loss of blood plasma through capillary walls into the surrounding tissues by extravasation. There is no actual fluid loss from the body, but this is because the bacteria or the microorganisms produce certain toxins which cause vasodilatation that in turn leads to a drop in the blood pressure and then leading to shock. Number 4, cardiogenic shock. This is a type of shock that results when there is an interference with the pumping of the heart, as might occur in myocardial infarction or cardiac tamponade. This leads to inadequate blood circulation to the heart muscle and eventually leads to shock. 5, anaphylactic shock or histamine shock. This is a type of shock that follows an injection of a serum. For example, anti-tetanus serum. It may happen in patients who are allergic to serum or those who are at one time had the injection and were sensitized. It comes about due to substances released known as histamines, which act on blood to cause them to dilate, and the resultant low blood pressure secondarily causing anaphylactic shock. The pathophysiology of shock. Shock is always either accompanied by loss or withdrawal of blood from the body's main vascular channels. This results in the fall of the cardiac output, which eventually leads into low blood pressure and diminished oxygenation to tissues. There is vasoconstriction, which is narrowing of the blood vessels, which is nature's first aid for shock. The arterioles become narrow, hence the blood pressure is maintained. When this happens, Blood pressure is also maintained, and hence oxygenation to tissues is as well maintained. This is a protective mechanism which works for a time, and this is just for the time when the threat to life is supposed to stop. So the body reacts in this way so that it tries to combat the danger that is happening. It is during this time that interventions to correct the cause can be put in place. The patient may completely recover, giving a type of shock known as reversible shock. If the cause of the shock is not treated or the shock persists, then oxygen supply to tissues is diminished. Tissues die, and this leads to a type of shock called irreversible shock. Irreversible shock. This is when the body has failed to combat the complications that are occurring, and hence it leads to irreversible shock. The body cells stop receiving oxygen and they eventually die off. The clinical manifestation of shock. 1. Hypotension. Hypotension is low blood pressure which comes about due to a drop in the blood volume. Body weakness due to poor tissue perfusion. Thirst due to loss of body fluid, which is blood or plasma. Pallor due to a decreased blood supply to other parts of the body. Tachycardia, which is an increase in the heart rate. This is a compensatory mechanism that the body puts in place so that it can combat the decrease in blood pressure. Cold and clammy hands and feet. This is due to poor blood supply to the body extremities. Restlessness, mental state changes. Mental state changes due to poor blood supply to the brain. There is also profuse sweating. Remember, these signs and symptoms are coming about due to a decrease in the blood pressure or due to loss of blood. Principles of management of shock. Principles of management of shock. 1. Identify and remove the cause. 2. Replace body fluids. 3. Position the patient by elevating the lower extremities at about 20 degrees. Keep the knees and trunk horizontal and the head slightly elevated. Keep the patient warm slowly but do not overheat. Relieve the pain by administering morphine or pethidine as prescribed. Administer vasoconstrictors as early as possible because if delayed, this may cause damage to the liver, kidneys, or brain. Give methadone 15 milligrams. Give noradrenaline intravenously 4 ml in a liter of normal saline. Give hydrocortisone 100 milligrams intravenously. That is how you respond to someone that is in shock. Complications of shock. 1. Neurogenic dysfunction. 2. Renal failure. 3. Respiratory dysfunction. 4. Hypothermia. 5. Multiple organ failure. Thank you for watching this video. We have come to the end of the discussion on shock. We've talked about the definition, we've talked about the types,